name is Emma Hageman, and I'm the technical lead for the FCDO Promoting Equalities Regional Programme PEPR that designed and manages the Equalities Resource Hub. The hub brings together evidence and tools to support policymakers, researchers, and practitioners in advancing gender inequalities around the world. With the Global Disability Summit fast approaching, coming up in April, it's a crucial moment to discuss how we can drive real progress on disability inclusion in a global context where there is a rollback on rights. So today, I'm very lucky to be joined by Claire Walsh and Lois Ota to discuss the 6 principles for disability inclusive development, a framework that was designed by Inclusive Futures, UK AID's flagship disability inclusion initiative that ensures people with disabilities are meaningfully included in development programs. So Claire here today is the Deputy Programme Director of Inclusive Futures, a global leader in international development, and provided technical guidance and review on the 6 principles. We are also joined today with Lois, who is the CEO of the Network of Women with Disabilities, a pioneering organisation she founded to ensure that women with disabilities are included in national policies and development agendas. So in today's conversation, it'd be great if we can all discuss a bit more about how these 6 principles were developed, what they mean in practice, and what you think needs to change to ensure genuine disability inclusion in global development. So Claire, Lois, great to meet you and to have you both here today. Welcome.
Thank you. Nice to see you
Thank
both.
you.
Great.
Thank you for having me.
Yeah, you're very welcome. So Claire, I'm going to turn to you first, just to give us a brief explanation of the Inclusive Futures programme that was responsible for developing these principles and what the 6 principles are.
Okay, thanks, Emma. I mean, you gave a great introduction for the Inclusive Futures program. So we are the FCDO flagship Disability Inclusive Development Program, and we focus on improving outcomes for people with disabilities in 4 areas. So health, jobs, education, and we also look at addressing negative stereotyping and discrimination. The program is co-governed by the International Disability Alliance and Sightsavers, so bringing together the disability movement and an INGO, and that kind of principle is core to this program. So we're really looking to meaningfully engage OPDs and people with disabilities in our programmatic work. Lois is one of our partners, and that's why she's here today. So yeah, we work in 5 countries. So we work in Nigeria, where Lois is based. We're also in Uganda, Kenya, Tanzania, Nepal, and Bangladesh. And the other thing that's kind of unique, there's many things that are unique about our program. But the other thing is that we have a big commitment to generate research, evidence, and learning about disability inclusive development. So we all know there's a really big gap when it comes to evidence about what works in disability inclusion and what works for people with disabilities. So I think the 6 principles is really a learning product that consolidates all our implementation experience from the first 5 years of our program. Early on in our work together, we realized that our kind of unique selling point was the power of our partnerships. So we bring together local and national governments in the countries we work. We work with OPDs, IDA, we work regionally with ADF, and we also work kind of at a national and local level. We work with research institutes, we work with Social Development Direct, which is a social enterprise, and we're really looking to make disability inclusion a reality in what we do, learn from it, communicate it in an easy to understand way.
And what was the process then for developing these 6 principles? So you said you consolidated all the implementation experience over the first 5 years. How did you develop them and who was involved in that process?
So the goal of our innovation phase, so the first 5 years of our program, was really to learn what worked and didn't work about disability inclusive
Mm,
development, and then to scale it. So from 2019 to 2023, we implemented 12 projects across four thematic areas. So jobs, education, health, and negative stereotyping and discrimination. We started simple. We did a desk review. We looked at all the evidence, learning, and research generated from those products,
mm.
brought it together with some key informant interviews, and then also engaged our consortium partners in technical reviews.
Brilliant. Thank you so much. It sounds like a really collaborative process over a period of time. Um, so how do these principles align with global disability inclusion efforts that are taking place, such as the Global Disability Summit, the GDS, that's coming up?
Yeah, so global disability inclusion efforts are facing huge challenges right
Mm,
now. Um, I mean, the context in which we're operating is just rapidly changing. I mean, at a speed that I've never seen. I've been
yeah.
working in development for 17 years now, and it is just every day something new. And as kind of we see the realignment maybe away from commitments to promote and protect the human rights of people with disabilities, I think learning like the six principles becomes even more kind of important and crucial because
Yes.
it's really grounding, it's really practical, it's based on experience, it's based on partnership with OPDs and people with disabilities. So this is something that people can kind of practically implement or even use as evidence in their advocacy efforts because this is something that's achievable. This is something that we've kind of broken down in easy to understand language. Yeah, so we are going to be at the GDS with
Mm,
Lois. She's going to be
brilliant.
on our panel again. So we'll be there with, talking about the six principles with Ida, with the UK government, with Lois, and also with Esther from the um, from UDPK, the United Persons of Disabilities of Kenya. Yeah, so very timely, very
Mm.
important to provide this kind of real way of doing things.
Lois, coming to you, it'd be great to hear a bit more about your work leading the network of women with disabilities and why you founded it.
For too long, women and girls with disabilities in Nigeria and other developing countries have been sidelined, excluded, and underrepresented in the development agenda. And another key reason why Network of Women with Disabilities was founded is due to the peculiarities of women and girls with disabilities and the barriers they face in their daily lives, the challenges, the stereotypes,
Mm.
and other issues led to the founding of Network of Women with Disabilities. We have over 100 women and girls with disabilities that joined the network since inception. And
Okay.
so far, we're working on economic development, health, climate change. We're also working on the political participation of women with disabilities because we are at a 0% level of participation in politics. We are abysmally low when it comes to appointment and elective positions. So we try by all means to advocate to the duty bearers, gatekeepers, and all the stakeholders on the need to include issues of women and girls with disabilities.
Thank you. It's lovely to hear from you, Lois, and hear a bit about the intersections between gender and disability as well, and some of the barriers that young girls face. So thank you so much for sharing that. I'd love to hear from you from your perspective, and from the work you do as your network of women with disabilities, why you think the six principles are important.
Yeah, the six principles are very, very significant and important to our work because, like number six, partnerships is also goal 17 of the Sustainable Development Goals on partnerships. So you can see the linkage between SDGs, persons with disabilities, UNCRPD, and the six principles. We are very proud of the initiator of these six principles. And we also need to talk about data. In Nigeria, is a big issue. Data is nowhere to be found whenever you're planning for a project, any activity on gender, on disability, and so on. We are still relying on World Bank statistics that was done many years ago and is an estimate, not a real data capturing. So in Nigeria, I will tell you, we don't have data of citizens with disabilities in this country, let alone women and girls with disabilities who are highly excluded from everything government and private sector is doing. So we think and we are proud of FCDO and Site Savers, Inclusive Futures, or whoever was involved in coming up or developing these six principles, because it's going to remind governments, different governments, about the real thing to do when including persons with disabilities in our various work. So I'm very realistic that if or when these six principles are implemented, it's going to give room for inclusion. It's going to engage persons with disabilities. It's going to empower persons with disabilities and also create an enabling environment for persons with disabilities to thrive. Thank you.
Thank you. So you've talked a bit about the partnership principle, the importance of collecting data, disaggregated data. Do you think one principle more than the others makes the biggest difference, or do you think they're all equally important?
Yes, all the principles are equally important to our work. But for me, I choose the number 3, which talks about breaking stereotypes and removing barriers from our work. These barriers could be attitudinal, it could be infrastructural, it could be medical, it could be institutional, it could be economical. But when these barriers are removed, we become independent as persons with disabilities. For example, when a building, let me use the example in Nigeria, Federal Secretariat is an inclusive and accessible building, then I have the right to go to my office and play my own role and develop my country. But when you get to a building, the first thing you see is staircase instead of a ramp. Or you attend an event as a hearing impaired, but no sign language interpreter or translator for those that do not understand English. Or you want to cross the road and you don't know how or when to do it as a visually impaired person. These are big issues. But when those barriers are removed, when you have a ramp, you have an accessible toilet, you have an accessible parking lot, you have sign language interpreters at strategic points, you can move from point A to point B independently without being assisted, then we will begin to see inclusion coming into play without asking questions. When we are setting up committees, we have representatives for persons with disabilities in all the global platforms. So we need to remove all barriers to enable persons with disabilities to be educated, to be empowered, to be engaged, and to have an enabling environment, which is the 4 E's that I always talk about: education, engagement, empowerment, and enablement. Thank you very much.
Thank you, and for sharing some real barriers that persons with disabilities, particularly women with disabilities, face. So it sounds like you think the principles do reflect the real priorities and challenges of persons with disabilities. Is that right?
Yes, yes.
That's great. Woo! Otherwise, we'd be in trouble. Things would get a bit awkward.
What lessons have you learned so far about the challenges that organisations of persons with disabilities face when trying to implement these 6 principles, or other organisations that are trying to be more disability inclusive?
Yeah, I mean, Lois and I are aligned because
Hmm.
I picked principle 3 as well to
Okay.
talk about, which is talking about kind of shattering stereotypes. But it's rooted in stigma and discrimination. And I think everyone I've spoken to talks about stigma and discrimination as being a huge barrier for people with disabilities, as Lois has articulated. But I think this is where kind of organizations fall down a bit. It's upfront in their theory of change. It's in their communications. Like if you look at any INGO that works in disability, they always have, a very people-centered approach, talking about how, they've overcome barriers or what those barriers are. But when you kind of see that boots on the ground implementation, where you have targeted activities that is looking at stigma and discrimination and measuring it effectively, I think there's a gap. I think that's a really a big need for improvement. So I think, yeah, I mean, I think even the Inclusive Futures program didn't do it as well as it could have. So we did address negative stereotyping and discrimination. It is one of our thematic areas, but I think it's a big learning for us as well. So we initiated a learning project on it actually, and the
Hmm.
technical report has just come out. And I think it's telling us that INGOs need to partner with OPDs in this area, need to engage their expertise, need to fund them directly to work in this area. And I think also we need to start developing our capacities in kind of measurement, activity planning, bringing this kind of up to speed where it needs to be.
It would be great to, yeah, showcase that report when it's available. It sounds like an excellent report, Claire. I echo that, and I think there's also some work to be done around looking inwards at our organisations as well, and our own individual and organisational, cultural,
Yeah.
social norms and biases that we might carry with us. So yeah, that very much aligns with my views as well. So you've shared a bit about where there are gaps. Can you share an example of a program or organization that has successfully applied these principles and tackled particularly the aspect of kind of principle 3, the stereotypes and barriers?
Yeah, I mean, I I think with stereotypes and barriers, our
Mm,
strongest examples are from our OPD partners.
yeah.
So I think we've worked in Nigeria to look at negative stereotyping and discrimination when it comes to sexual and reproductive health rights. And so we've partnered with kind of local OPD leaders, kind of regular people with disabilities, just to look at how we can work within the communities to change those social norms. But I also wanted to share another example about
Mm,
the successfully applied principles, which is talking about tracking the money.
mm,
Um, I think this is something that Site Savers is doing well. I think, or at least trying to do well. I'm always a little hesitant to kind of say, oh, yes, we've got this. It's amazing. But they're right now working on a case study regarding their spend on reasonable accommodation. So I think, Lois, you kind of explained this a bit earlier, essentially, kind of how we provide accommodations or services so people can equally participate in a workshop. I think the
mm,
great example of, having sign language interpreters. Also, I think the most important example Lois gave is talking about language translation as well. So
yeah.
we often find that women with disabilities in Bangladesh, for example, don't speak English, but the OPD male representatives do. So when they attend, they need English translation as well as perhaps sign language interpretation. So there's kind of that intersectionality to think about as well. But anyways, I kind of like love that example because I think it kind of just shows you all the
Mm,
layers that you have to think about when
yeah.
you work on inclusion projects. It's not just one thing, it's like many things.
Yeah.
Um, but yeah, the finance I think is interesting. So I'm not a finance person, but Site Savers has created this like bespoke system where they can code all their spend and
Mm,
then track it. So they are actually working on a case study to share and be transparent on how much they're actually spending on reasonable accommodation to give an example of what kinds of things organizations need to do to make inclusion happen. So I think that's going to be something really exciting coming up.
yeah, definitely. And a first of its kind. I think I've not seen such a case study before. So really useful for those that do want to do more and but don't know how. And having that live case, practical case study would be really, I think, really useful. So yes, great. I think that's a really good example. So Lois, coming back to you, what difference would applying these principles make for people with disabilities?
Yes, the huge difference we are going to see or realize in our different communities when these six principles are applied and are achieved is inclusion.
Mm,
People will be included. Our rights on disability will be given to us. Our voices will be amplified. Enabling environment will be created. And many partnerships will come into play. There will be funding streams for organizations of persons with disabilities, and many other things will be achieved greatly when these six principles are applied accordingly. Thank you.
brilliant. Thank you both. So now to wrap up, it would be great to hear from both of you. If you could give one piece of advice to an individual or an organization that wants to strengthen their work on disability inclusion, what would it be?
Yes, for me is both individuals and organizations, they should include disability in their agenda. Most government have agendas. When Claire started speaking, she talked about there are four thematic areas they are working on to make sure disability inclusion is achieved? What about government of Canada? What about government of Nigeria? What about the United States and other countries all over the world? How are they adopting these principles? So for me, they should pick one of these principles and include it in their agenda. Thank you.
Thank you, Lois.
I think like in times like these, things can feel really overwhelming. I think it's kind of hard for an individual working in an OPD or working in a development organization to kind of think about where to start. I think the six principles provide some really easy, practical steps that individuals can take to start to be more inclusive. And I would really kind of encourage people to read the paper, to be curious, and to kind of reflect on their own practice and see how they can start to kind of make small steps towards inclusion. I think that's kind of a helpful thing to think about when the world is feeling kind of a bit overwhelming and change is happening so quickly. So that would be my thought.
Thank you both. Some really useful and really insightful things that have been shared here today. And I've really enjoyed having this conversation with you. And the GTS is just around the corner. So yeah, it'd be great to see what is discussed there and what comes out of those conversations, particularly around the commitments, Lois, and the uptake by others. Um, and who is committing to doing more, other donors, others working in the space. So let's see end of April what comes out of it. So this brings us to the end of the conversation. Claire, Lois, thank you both so much for a brilliant discussion. It's been wonderful to hear your insights on the six principles for disability inclusive development and what they mean in practice and what recommendations you have for others. So for those listening, if you'd like to hear more, please visit the Equalities Resource Hub at equalitieshub.org, where you can find the Six Principles report along with other key resources on disability inclusion. There you'll also find links to our LinkedIn accounts and can sign up for our newsletter to receive the latest news and updates straight to your inbox. So thanks again for joining us. I hope you've enjoyed the conversation just as much as we have.
Yeah, it was great. Nice to see you both.
It was
Lovely to
brilliant.
see you.
Thank you. Yeah,
Bye,
bye.
guys. Bye, Lois.